Thank you, Madam Chair, and thank all of you for your service and your willingness to come here today. I grew up. I was born in 1952, so the issues around abortion were of intense discussion, obviously, in those days. And my mother was a single mother, raised 4 kids by herself, and we discussed frequently the issues surrounding abortion. And this was kitchen table discussions. It was my mother's. No matter how lean our household budget may have been, she tried to give some donation to Planned Parenthood. Some years it was $10. But she felt that a woman who was forced to carry a child to birth that they were not ready for, that they didn't intend, was being forced to give up part of their life and to have challenges and obstacles that would make their achievements in life far, far more difficult and oftentimes would lead to devastating results. Colorado's a state where we are. We proudly support a woman's right to and access, the right of access to health care. But we are surrounded by states on 3 sides that have either or are going to or expected to enact abortion bans, and we will certainly see a large influx of patients. And I think this can stretch the providers in Colorado and other states that are already quite thin. It's going to impact access, not just to abortion, but to other reproductive services. So, Dr. Brandy, I'll start with you. How are these abortion bans impacting access to other reproductive health services, like contraceptive care, cancer screening, et cetera?
Thank you, Senator, for the question. You're right that while abortion bans on face value just impact abortion, they impact so much of reproductive health care and care that's entirely unrelated to reproductive health care. Things like we mentioned earlier, different immunologic diseases can be impacted because treatments are very similar. Or, for example, cancer cases where people may get delays in their care or may have contraindications to certain types of birth control that may not be accessible to them. There are so many ways that this is impacted, ways that medical physicians and other healthcare professionals knew about and were seeing through Texas. But every day I'm hearing a new report about a different medication, a different patient scenario, because every patient's unique. Every patient is an individual, and we in medicine have to be creative sometimes when we take care of patients, find new ways to treat different diseases. And when our hands are tied, when there are certain bans that just create a law without thinking about the people that it impacts, it's really challenging physicians to be able to meet that individuality of patients and give them the appropriate care that they need.
Great. Thank you very much. Dr. Taylor, I wanted to ask you also, in your opinion, what does this notion of government-mandated pregnancy or enforced pregnancy, what kind of outcomes is that going to lead to what kind of health outcomes is that going to lead to for women?
Absolutely. Thank you for the question, Senator. First of all, anytime we're forcing a person to continue with a pregnancy that they would like to terminate, it could impose various issues for that individual, whether it's stress, anxiety, mental health challenges. I think in addition to that, if we put this in the context of the maternal health crisis in this country, it could mean that that individual may not keep up with their prenatal care appointments. They may also struggle financially if they have to continue with a forced pregnancy. pregnancy. We also know that even if you look at something like higher education, we know that for a woman who can access an abortion, a college-age woman, that she's more likely to finish school. And so it really has an impact on the broader consequences of that person. I think another point I'll add too is that about 60% of people who have abortions are already parents. And so not having the opportunity to terminate a pregnancy for a woman and her family could mean that she is unable to care for and support the children that she already has. It could impose additional economic challenges for the broader family and could even lead to health challenges for the children that she already has. So it really is a broader issue that can impact various aspects of a woman's life.
Thank you very much. And just one last very brief question, if I can. I saw a number, heard a number last week that almost half of all pregnancies in America are accidental or unintended. Is that true? Is there any of you have that accurate number on that?
I can speak to that. Yes, about 45% of pregnancies are unintended, and about 40 or about half of them end in abortion. And so even though we talked earlier about percentages being very small, if you think about percentages on the broader sense, like the 14% of people, that's actually equatable to thousands of people that can become pregnant in our country. And so that's a huge impact for people across our country.
Thank you all.
Thank you.
Thank you.
Senator